Okay, so my case study is a 28-year-old female brought in by her husband post-fall at home while intoxicated. Husband states that she didn't hit her head. It was a witnessed fall. Patient comes in agitated, confused, and alert and oriented times one. She's oriented to person only. The husband states that the wife is an alcoholic. There are no signs and symptoms of trauma to the head or other injuries. So while she's here in the hospital, she's super agitated. She's yelling. She's exhibiting little inhibition. She's irrational. She becomes hostile. And then all of a sudden turns around and she starts apologizing for her behavior. A brief history is given by the patient's husband, and he says she drinks up to at least a fifth of vodka every day for the past year. So since there are no signs and symptoms of head trauma, the physician orders the nurse to start an IV, and the nurse calls an EMT or an ER tech to the room to observe the patient while she goes to get her supplies. As the RN only anticipates being gone, briefly just to run and go grab her IV supplies, no handoff report was given, and as the ER tech stepped into the room, as she stepped out of the room, patient yelled, "I have to go to the bathroom," and then tried to climb over the bed rails and then tumbled to the ground and landed on her right hip. She complained of severe pain in her hip. The physician ordered x-rays, stat, which showed a right hip fracture, and the patient was admitted to this hospital to undergo surgery. Surgery was performed later that morning, and her length of stay was 9 days. So all of this could have been avoided if she had not fallen out of bed. And now we're going to go over the fishbone diagram.